Hello everyone, I am Dr. Abhijeet Kumar and today we will discuss a case related to post-term pregnancy. So let's start. So the question says that a woman with post-dated pregnancy at 42 weeks comes to your clinic. So what is the initial evaluation that you would do? Option A says induction of labor. The second option says review of previous menstrual history. The third option says cesarean section. And the fourth option says ultrasound. So yes, most of the time the students are answering option D, ultrasound. But again, read the question, students. It says that what is the initial evaluation that you will do. Initial means the first step what you should do. It is never an ultrasound to be done. The first step you have to do is to review the previous menstrual history of the patient, and that's why the answer over here will be option B. It will not be option D, it will be option B. Whenever a female with post-dated pregnancy comes to you, you have to first review her menstrual history. So let's discuss something related to post-term pregnancy. The very first point, that what do you understand by the post-term pregnancy? It is any pregnancy which is more than or equal to 42 weeks. Very important. Yeah, it is any pregnancy which is more than or equal to 42 weeks. Now, how to calculate the expected date of delivery, also known as EDD, expected date of delivery. So that is calculated by the help of Naegeli's formula. Now what is this Naegeli's formula? Yes, it is the first day of the last menstrual period, that is the LMP, and to the first day of the last menstrual period we have to add 9 months and 7 days. For example, let's just discuss this. If suppose in the question it is given the first day of the last menstrual period, that is the LMP, it is given as 1st October 2021. So now what will be the expected date of delivery? So what you have to do, you have to add 9 months to this particular date. So it is already October, so you have to add 9 months. It will be November, December, January, February, March, April, May, June, July. So you know it will be July and it will be 2022, and after you have added 9 months you have to add 7 days. So it is 1st October, adding 7 days to this, it will actually become 8th July 2022 will be the expected date of delivery for this particular case. Okay, so you have to keep in the mind that first day of the last menstrual period it is to be taken, and to this particular date we have to add 9 months and 7 days. Moving further ahead, see, 4% females are there who actually deliver on exact expected date of delivery. 50% female deliver either 1 week before or 1 week after expected date of delivery. So it is only the 4% which will be delivering on the expected date, whereas 50% will be like 1 week before or 1 week after this. And the question which I have discussed, and you should always keep in mind what is the initial or the first step whenever a post-term pregnant woman visits to you, is to review her menstrual history. That is very important. So coming on to the next question, in post-term pregnancy there is increased risk of fall except. So the question says what are the risks basically in post-term pregnancy? Everything can happen except, so postpartum hemorrhage, the second option meconium aspiration syndrome, the third one that is the intracranial hemorrhage, and the fourth one that is the placental insufficiency leading to fetal hypoxia. So let's start with this. So what are the complications related to post-term pregnancy? The very first one, that is the oligohydramnios. You all know that oligohydramnios means that the amniotic fluid will decrease. So oligohydramnios in pregnancy, it is occurring at two times. It is during the initiation of the pregnancy or at the last of the pregnancy. So as you all know that the as pregnancy advances, the volume of amniotic fluid will decrease, and see, oligohydramnios will be seen late in pregnancy. That is what we are talking about. That is the post-term pregnancy now. Okay. So what will happen? There will be less space. Less space will actually lead to cord compression. See, cord of the baby will get compressed. The umbilical cord will get compressed because of less space. Okay. Amniotic fluid, if it is present, it is providing space for the fetus, okay, to develop. Ultimately, if there is less space, cord compression will be there. The cord of the baby will get depressed, and you all know that the cord contains umbilical artery and vein. Now, if suppose the umbilical artery and veins are depressed, ultimately they will not be able to carry the proper blood supply to the fetus, and it will again result in fetal distress. And that is why the fetal will start passing meconium in the amniotic fluid, and that will actually lead to the meconium stained amniotic fluid. And this fluid, now you all know that amniotic fluid is kept in balance. How? It is after 20 weeks it is produced by the fetal urine, and ultimately the amniotic fluid is further swallowed by the fetus. So this is how the amniotic fluid is kept in balance. And same the fetus will try to do over here also. It will try to swallow the meconium stained amniotic fluid, and that will lead to meconium aspiration syndrome. So remember guys, post-term pregnancy, basically the very crucial complication of this is meconium aspiration syndrome, and this is how it spreads. Okay. Apart from that guys, I wanted to discuss that another complication that is called as macrosomia. You know that 42 weeks basically means the weight of the fetus will be much large. Okay, excessive weight of the fetus will be there. And remember, if it is actually through the okay, the excessive fat basically will be deposited on the shoulder of the fetus, and that's why it can lead to shoulder dystocia. While vaginal delivery, you will try to pull the shoulder, it will not pull out, and that's why macrosomia can increase chances of intracranial hemorrhages. That is again a very important complication. Apart from that guys, remember that macrosomia is basically itself increases chances of cesarean section. Okay, because in normal vaginal delivery it will be very difficult to pull the shoulder of the baby out through the vagina, as you know that the more fat will be deposited on the shoulder, and it can again lead to shoulder dystocia. So ultimately macrosomia is increasing the chances of cesarean section. So macrosomia, yeah. Apart from that guys, another complication that is faced by post-term pregnant women, it is placental aging. See, as the age of the placenta is increasing, remember the placenta, it will lead to placental insufficiency. Placenta will not be able to work as normal as it was working throughout the pregnancy. So ultimately the aging of placenta will actually lead to its insufficiency, and you all know that placenta is responsible for providing all the things from the mother to the fetus. Ultimately exchange is happening through the placenta only. So if there will be no proper blood supply, no proper food, no proper oxygen, no proper metabolic waste removal, so it will lead to fetal distress. It will lead to fetal distress. And that's why these are the three main complications that you should know. That the very first one, it was regarding the oligohydramnios, which will lead to meconium aspiration syndrome. Apart from that guys, you should know about macrosomia and placental aging, which will result in fetal distress. So coming to the question, you all know that yes, option B can be there, meconium aspiration syndrome can be there in postpartum pregnancy, it is a complication. Apart from that, intracranial hemorrhage can be there, and placental insufficiency leading to fetal hypoxia. So decrease in oxygen will be there. Okay, so placental insufficiency, placenta advances with age. Ultimately the function of the placenta will become less, and it will actually lead to fetal hypoxia. Okay, So all these three complications can be there, but there will be no postpartum hemorrhage in this case. So ultimately the answer of the question, in postpartum pregnancy there is increased risk of meconium aspiration syndrome, intracranial hemorrhage and placental insufficiency leading to fetal hypoxia. These all can be there, but postpartum hemorrhage is never included in that. Okay, so that's the answer of this particular question. Apart from that, guys, I wanted to discuss some important aspects related to amniotic fluid color, because these are frequently asked questions in FMGE exam, and you should know that green color amniotic fluid, that is because of meconium, it will be actually seen in conditions related to fetal distress. That is very, very important. Apart from that, breech presentation whenever the fetus is lying transverse, and listeria infection. In that case also the amniotic fluid color will be green. The saffron colored or the yellowish green colored amniotic fluid will be seen in post-dated pregnancy. Next, tobacco juice colored amniotic fluid, it will be seen in intrauterine death, and the golden color amniotic fluid, that is due to bilirubin, and that will be seen in RH incompatibility. That will be seen in RH incompatibility. I'm putting a dollar sign in this on this particular slide, as you should know that these are some important points and that you have to keep in your mind before going to the exam. Apart from that, guys, one more thing, that anencephaly can also lead to post-dated pregnancy. Now, guys, you all know that anencephaly, basically the majority of the portions of the brain wouldn't be there. So you know that the pituitary gland, which is situated in the sella turcica region, may be absent. And you know that the pituitary gland is the one which is actually responsible of the fetus. Basically, it will actually responsible for the fetal ACTH, adrenocorticotropic hormone. It will, so fetal ACTH will give signals to the fetal adrenal glands to release DHEA sulfate. You all know that DHEA sulfate will be used by the placenta to synthesize estrogen, and this estrogen will be actually responsible to signal the uterus to start contraction, and that is how the process of labor is initiated. But you should remember that if suppose fetal ACTH is not there, okay, pituitary gland is absent, ultimately no signals will be sent to fetal adrenal glands, no production of estrogen would be there, no contraction would be there. So the spontaneous precipitation of labor would be delayed, it wouldn't take place, and that will again lead to the risk of pregnancy which is progressing into post-term period. Okay, so ultimately it will lead to post-term pregnancy. So you should understand, guys, that anencephaly is the condition where majority of the parts of the brain are absent, and ultimately in brain basically there is the pituitary glands containing ACTH, and ultimately these are the ones which will give signals to the adrenal glands of the fetus to synthesize estrogen, and that estrogen is only responsible for the contraction or initiation of labor. Ultimately this whole process will not take place, and that will again lead to post-term pregnancy. If labor is not initiating on time, ultimately there is no labor pain, it will further lead to post-term pregnancy. And one more thing that you guys should know, that anencephaly is basically it's first detected on ultrasound. It is again a question. It is first detected on ultrasound basically around 10 weeks. Okay, at 10 weeks you can detect anencephaly on ultrasound, whereas the best time to detect it is 14 weeks. The best time to detect anencephaly, it is on ultrasound, it is around 14 weeks. And remember, so what are the signs that you will see on ultrasound? Yes, that is the Mickey Mouse sign. You can write it over here. That is the Mickey Mouse sign, also called as the frog eye sign. Frog eye sign, and that is the appearance that you will see on ultrasound in case of anencephaly. And remember that it is the first congenital anomaly detected on ultrasound. Okay, so it is the first congenital anomaly detected on ultrasound. So yes, so this is something which is related to anencephaly also. All the potent questions that can be asked or which are more frequent questions, it is just displayed on the screen. So yes, um, yes, you can remember this, okay, that it is first detected on ultrasound around 10 weeks. Best time to detect, it is 14 weeks. First congenital anomaly which is detected on ultrasound, again it is anencephaly. And apart from that, what are the signs that you will find on ultrasound? It is the Mickey Mouse sign or the frog eye sign. Thank you.